Hi, good day to you. Today, we're going to learn how to educate patients on self-administered insulin pen. Before we start, we need to assess our patient or their caregiver on the pen knowledge related to self-administered insulin pen. The teaching today will focusing on the patient or the caregiver being first time introduced to self-administered insulin pen. Firstly, you have to provide basic information regarding the insulin pen itself. For example, the name of the insulin, what is the color code, the dosage and frequency, there's how many units and how many times per day, and when they're going to inject this insulin. Followed by introduce the equipment that needed for the procedure. There's 3 insulin pen, needle, and alcohol swabs. Introduce all the parts of insulin pen and needle to the patient or caregiver if can. If the patient is using this type of insulin pen, they need to learn how to insert the pen fill into the cartridge holder. Firstly, you have to pull off the pen cap and unscrew the cartridge holder. If the rod is sticking out, push it all the way back. Insert the insulin into the cartridge holder. Remember color code and first. And screw the cartridge holder back together and twist it until you can feel or hear a click sound. If the insulin is cloudy types, the patient have to always mix evenly before use. There's 2 ways to do about it. First, you can gently roll the pen between your palm for 10 times, or you move the pen up and down for 10 times. After this, we need to assemble the needle on the insulin pen. First, clean the rubber shield with alcohol swabs. Remove the protective tab from the disposable needle and attach to the insulin pen. Remember, the needle is single use. Now, the pen is ready to be used. Before inject into the patient need to prime the needle and make sure there is no air inject into the body. First, remove the both outer and inner needle caps. Dispose the inner cap but keep the outer cap. How to prime the needles? Turn the dosage button to 2 units. Hold the insulin pen with the needle pointing upwards and press it until it returns to 0. A drop of insulin should be appear at the tip of the needle. Now you are ready to be injected into the body. If the insulin dose didn't appear, please repeat the steps. When the insulin pen is ready, turn the dose selected to the number that's needed as instructed by the doctor. Now, where to inject? For self-administered insulin, the patient are advised to use abdomen and thigh, and abdomen is generally recommended. The area can be injected on the abdomen is 1 inch away from the umbilical cord. And remember to tell the patient to rotate the spot to avoid complications. After the area has been identified, the patient is advised to use a wet cloth to clean the area. Then insert the needle at 90 degrees and press the button all the way until it's 0. And remain the needle in the skin and count 1 to 10 to ensure the full dose is being injected. Then pull out the needle. After injection, lead the needle tips into the outer needle caps and unscrew the needle and dispose into a puncture-proof container. Now it's come to end of the session. If you have time, you are advised to read out further information about the insulin pen. Thank you.